generally. And, my passion is for women, either in, care of a woman or care of maternal child. That's my passion. So I'm going to be talking about just basic health maintenance for women, okay? When, every time, we tell women that they need to see their doctor. So we ask that you see a practitioner, an obstetrician, sometimes a nurse practitioner that's affiliated with women's care, or sometimes physician assistant, physician extender. So we ask that you see a doctor at least once every couple years. And when you do go to see the doctor, we're doing certain things. We're evaluating you, we're screening you, and we're trying to focus on health care prevention of diseases and stuff like that. So one thing that we do when you come to the office is cervical cancer screening. And you can look at it, the incidence and the mortality of cervical cancer is fourth most common. And worldwide, there are about 570,000 people diagnosed with cervical cancer. And over 300,000 die from the disease. So that's why it's very important that we screen our women for cancer of the cervix. The average type of screening is 21 to 65. After 65, we don't believe in additional further screening. And then, of course, like I said, the frequency is about every 3 years, every 5 years. But remember, that's particularly for the screening test, which is a PAP test. We still ask, even though you get your PAP every 3 or 5 years, you still got to see the doctor like every 2 years. You will notice that I put in HPV, PAP and HPV co-testing. So you will understand why we push it to 5 years interval. Once you're over age 30, we do the PAP the PAP smear and the HPV testing every 3 years. The reason being that the HPV, human papilloma virus, is the primary cause of abnormal PAP test. It's sexually acquired, it is a sexually transmitted infection, but it takes about 5 years before it starts making significant changes in the cells that's coming or produced from the cervix. So because of that duration of time, and the fact that if we decide or determine that you do not have the virus, we can push your cervical testing for 5 years. But if you do have it, we have individualized care for such patients. And of course, how do we prevent cervical cancer? One of the ways that we prevent cervical cancer is by administration of the shot, the vaccine, the HPV vaccine. There are several other things that goes along with prevention of cervical cancer. One partner at a time, preventing multiple sexual partners. If you do not smoke, that helps you to prevent cervical cancer. People who are immune compromised by various ways. Sometimes stress can actually, compromise your immunity. So we ask that you eat healthy, protein-rich diet, prevent stress, diseases that can predispose to the infection with HPV, like, HIV, diabetes. Those are immune-compromising diseases that we want to stay away from. And if we do have them, like I tell my patients, no one picks a pen and write a letter to, someone and say, I want to have, diabetes. So, but there are things you can do to prevent developing diabetes. There are things you can do to prevent developing HIV or several other diseases. There is a lot of, advocates out there trying to encourage women about early cancer screening for cervical cancer. And then this is essentially a little diagram about, how one gets the infection and it transfers from just that little infection to cervical cancer. What I tell my patients is that cervical cancer is not really a genetic disease. It's an infection by the HPV that has high oncogenic characteristics, meaning that it has a tendency to cause abnormal cellular division, and over time, you can develop cervical cancer. okay? And on the average, it can take, depending on how aggressive the virus is, it can take about 5 to 8 years from time of contact with the virus to developing cancer of the cervix. And we do categorize them because there are several serotypes of the HPV. So we categorize them into the low risk and the high risk. And based on the categories, it usually guides us as to how to manage our patients. The notorious one is 16 and 18 when it comes to cancer of the cervix. And then when you look at, there are some low risk that also causes warts, genital warts. So we also need to be cognizant of those viruses. And this is more or less a trend of, infection and progression to invasive cancer. At the initial period, what we try to do is actually catch women at the infection stage. When my patients come in, they're like, I have cancer. I'm like, no, you don't have cancer. It's just an infection. You have about 70% chances that this will transition back to normal if you maintain a good health and, no stress, nothing, no high cortisol, and things that will predispose you to persisting of the infection of the viral, viral processes. So initially, it's just an infection. The goal is to catch it on time, and so we can take care of women before it progresses to cervical cancer. In America, the good thing about America is this, that if you see your primary care doctor, they will tell you to go and see, your gynecologist. It's not like in Nigeria where some people, like the first time I got my pap smear was when I came to America, and I was like maybe 29 at that time. And imagine, I'm a physician. I never thought of going to get a pap smear while I was in Nigeria until I came to the US. So it's not very, as far as the health education in Nigeria, it's not very common, and hopefully maybe we'll get to a point that we will continue to advocate women going for screening for cervical cancer. And when you see cervical cancer, most times in Nigeria, it's already gone too far and too late. Now, this is the progression of the disease again. That's the normal cervix, and that's I don't have a pointer, but this part is the cervix, and that's the uterus. And this part is when you just have the cancer at the very, beginning, early stage. Again, this can be prevented such that there's no distant metastasis. And right here, you're talking about stage 1B. It can also be prevented, but when you have something like this has gone too far, and it's spread already. Now, I hope I was able to cover enough on cervical cancer. And the bottom line is, when you look at the female reproductive organ cancer, cervical cancer is one of the most preventable cancer if you follow the doctor's recommendation. And I usually tell my patients that, as long as you stick with the doctor, you will not develop a cancer. Now, the next one is breast cancer. It's the second most common cancer for females. And screening usually starts at age 40 to 75, depending on, the guideline that we use. I use the ACOG guideline, American College of Gynecologists, and we do it once every year from age 40. There are other factors that could modify the screening frequency. Sometimes people can come in every 6 months because they have a high family history or they have a personal history. There are people who come in where we do their genetic screening. They have the BRCA gene, the breast and ovarian cancer gene. Such people need earlier screening. But if you don't have any history, once you're 40, you say hello to mammogram. Breast cancer awareness is one of the things that's done, globally. Susan Komen is a global awareness. People run just to raise money so that people can get screened. I don't know how popular that is in Nigeria again. When you look at breast cancer, the risk is for every 8 women, one of them is going to develop breast cancer. That's how bad, and that's how notorious, and that's how prevalent it is. For every 8 women, one will be diagnosed with breast cancer. So it's very important that we do breast self-exam. There are other factors that can affect the, the incidence. Like, if you have children and you breastfed women, please breastfeed. I have 4 and I breastfed all of them. Even the twins, I breastfed them. So breastfeed, because breastfeed is been known to decrease risk of developing breast cancer. And then of course, this is just a picture of breast cancer. And sometimes the disease might not even be palpable. You can go to the doctor for clinical breast exam once every year. If it's very small, if it's less than 1 centimeter, the doctor may not be able to palpate it. And that's why the mammogram starting from age 40 is very important. Okay? And that's just a picture of the breast. And you can see, here is where the cancer is. This is so minuscule compared to the size of the whole mammary gland. It's okay to check your breast. Okay? Sometimes, a long time ago, they were advocating having a body to, check your breast if you're not confident. Your husband can check the breast as long as it's in the right place while he's doing that. The partner checking the breast, my dick is something else. So, as long as you respect my view and you're not intoxicated with alcohol and stuff like that, it's true that you can check your breast. Your sisters can check breast, moms can check their daughter's breast and stuff like that. Okay? Things that you should look for in the breast. You want to feel for the lump. You want to look at the nipple. You got to stay in front of the mirror. Make sure that the nipple line is symmetrical. Make sure there's no dimpling in the nipple, because if there's cancer under the nipple or the breast, it pulls the skin in. So you want to make sure there's no dimpling and there's no dripping from the nipple, like nipple discharge. If you have any nipple discharge, you should call. If you have nipple discharge and you're not breastfeeding, you need to call the doctor's attention. You got to know what the color of the discharge is, how much discharge is coming. There are several things that can cause nipple discharge. Doesn't necessarily have to be cancer, but it's good that you check it out. And then of course, redness and changes in the skin. Now, the ovarian cancer. Unfortunately, when you look at the ovarian cancer, it's really not, we don't have a very reliable screening method for ovarian cancer. And ovarian cancer is so notorious that it's just that small ovary for someone who is not menopausal. The ovary is usually about that big. And for someone who is menopausal, it's about the size of an almond, very, very tiny. And it stays in a very roomy, spacious area. The pelvis is generally roomy for the ovary. So by the time it's diagnosed, unfortunately, it's gone too far. It has metastasized, it has spread. Or it spreads all over in the abdomen and the omentum, stuff like that. The American Cancer Society says about 21,000 is diagnosed, and you see the mortality is pretty high. 13,000 dies every year. And routine screening is really not recommended. However, like I said earlier, those who are tested positive for the BRCA gene, they can be tested earlier. Those tests, they're not really very sensitive. So we do ultrasound, a pelvic examination. That's just about it. Not so reliable. You would have to do 100,000 ultrasounds to find one person with ovarian cancer. Not very sensitive. And of course, there's always false positive. Patients will come in. Oh, remember that cyst I had in my ovary last year? I want to check it in. That's okay. You can get an ultrasound now. Stuff like that. It doesn't necessarily mean that it's going to pick up anything. And of course, there's also complications from false positive. Imagine the patient has a mass, because she has a history. You want to take her for laparoscopy. You're doing laparoscopy. There's complication from laparoscopy. So those are the drawbacks from ovarian cancer. It's not a fun disease to have. However, the screening is not so good, and we still have, advocates for ovarian cancer awareness. It is a silent killer. Don't let it sneak up on you. What are the reasons? What are the possible symptoms that you would have that would suggest you may have ovarian cancer? See all these women, they have ovarian cancer and they were being told several things. Because the symptoms are not specific. If someone has a brain mass or brain tumor, maybe they have headache and seizures and stuff like that. The symptoms of ovarian cancer is not that specific. some were told they have a weak pelvic floor. I've heard patients being told they have irritable bowel syndrome, and some they told them, they just bad eating disorder and allergy. Now, when you look at there are several warning signs, but again, so many. How many can you remember? But the common thing is pelvic pain, abdominal discomfort, and pain intercourse. Okay, all the things are there too, but it could be non-specific. It's really non-specific. But people should know that if they have persistent pelvic pain, abdominal pain, or pelvic discomfort with sexual intercourse, they should see their doctor. Some are complaining about abdominal bloating and swelling, which could be attributed to this IBS, but irritable bowel syndrome. But again, they're really